Pseudomonas aeruginosa causes some of the most serious and difficult to treat bacterial infections. It can cause pneumonia, bloodstream infections, and can infect many other sites of the human body. The CDC estimates that P. aeruginosa causes 51,000 healthcare-associated infections in the U.S. every year. 13% of these infections are multi-drug resistant, leading to 400 deaths annually. Nearly all studies of this pathogen have been population-wide, but the question of how it is affecting children, an important group, has not been investigated. This led CDEP researchers and colleagues to take a first look at national trends in multidrug and carbapenem resistance among children with Pseudomonas infections. Their findings are published in the Journal of the Pediatric Infectious Diseases Society. The research is based on antibiotic susceptibility test results from the Surveillance Network, TSN, which drew from clinical microbiology laboratories serving 300 hospitals across the United States from 1999 through 2012. For this study, test results from all children age 1 to 17 treated in outpatient, inpatient, and long-term care settings were included. The exception was cystic fibrosis patients, who were excluded to represent the general pediatric population. Multidrug resistance and carbapenem resistance were defined using CDC criteria. Multidrug resistance is defined as non-susceptibility or resistance to drugs in at least 3 of 5 classes of antibiotics: cephalosporins, beta-lactam-beta-lactamase inhibitor combinations, carbapenems, fluoroquinolones, and aminoglycosides. Carbapenem resistance is defined as non-susceptibility to at least one drug within the carbapenem class. Children accounted for about 88,000 P. aeruginosa isolates in the TSN database between 1999 and 2012, of which 77,000 were tested for susceptibility to carbapenems and 4 other antibiotic classes. Of these 77,000 isolates, about 16,000 were multidrug resistant, 9,000 were carbapenem resistant, and 6,500 were both. The highest rates of multidrug resistance and carbapenem resistance were found in ICU patients, patients with respiratory tract infections, and patients between age 13 and 17. The proportion of multidrug resistant Pseudomonas increased significantly between 1999 and 2012, from 15% to 26%, and of carbapenem-resistant organisms from 9% to 20%. This trend mirrors the increases in antibiotic prescribing in the United States over the same period. It is also indicative of P. aeruginosa's unique ability to survive in harsh environments and its intrinsic mechanisms that protect from the actions of certain antibiotics. The array of antibiotics used to treat P. aeruginosa infections has expanded over the years as resistance to many of them has increased. The high resistance rates in ICUs suggest a strong role for infection prevention measures, particularly protocols related to catheters and other medical devices. Antimicrobial stewardship can also help reduce antibiotic use, which can in turn reduce the spread of antibiotic-resistant organisms. To learn more, you can find a link to the publication on our website at www.cdep.org.